The following video discusses our technique for an all-suture anchor-based repair of meniscal ramp lesions. Diagnostic knee arthroscopy is initiated with the creation of anteromedial and anterolateral portals. The cartilage and meniscus are probed for any lesions within the anteromedial and lateral compartments. Next, the scope is taken from the anteromedial compartment and driven underneath the PCL through the notch. This will allow visualization of the posterior medial space and eventually the posterior compartment, where care should be taken to evaluate the meniscocapsular junction. Once the pathology has been identified, create a posterior medial portal using transillumination and a spinal needle, taking care to avoid any neurovasculature. A stab incision is then created at the entry site of the spinal needle, creating the posterior medial portal. Following this, insert the switching stick and the cannula. Biologically prep the lesion with a rasp and a spinal needle to improve healing. The repair may now begin through the posterior medial portal. Next, place a curved anchor guide along the posterior medial tibial plateau just adjacent to the meniscus side of the tear. Using the guide, drill until flush. Next, a 1.8 mm knotless all-suture fiber-tack soft anchor is placed. Test to ensure the anchor is secured. Next, a suture lasso is used to pass the suture through the posterior capsule tissue. The nitinol wire from the suture lasso is then retrieved through the posterior medial cannula. The repair suture from the anchor is then passed through the nitinol wire loop, and the nitinol wire is then pulled. The repair stitch is then placed into the passing suture of the anchor, and the passing suture is then pulled. The repair is tensioned to the desired amount. Use caution to not over-tension the posterior medial capsule. Once the desired tension is achieved, an arthroscopic cutter is used to cut the repair stitch flush. The meniscal ramp lesion is then re-evaluated with a probe to ensure stability. Remaining pathology may be addressed and procedures are completed as indicated.